Hello all. Today I'm going to discuss about one of very interesting regressive alteration of the teeth. So when we talk about regressive alteration of the teeth, we know we have seen about attrition, abrasion, erosion and abfraction, which is visible to the naked eye. But interestingly, this regressive alteration of the teeth is cannot be visualized in the naked eye, and it is not shown exteriorly. This is more of a thing that happens in the interior structure of the teeth, which is called as a pulp stone. Okay, so I'm presenting a case scenario where a 38-year-old otherwise healthy patient reported to a clinic with hypersensitivity to cold stimulus in the right upper back tooth region. So from the history, it is slightly giving us a clue that there is a kind of a reversible pulpitis that the patient is suffering from. So obviously, an RVG was taken to assess the pulpal involvement, and under the RVG, there was a radio opaque mass in the pulp chamber of 1/6. So if you see here, the 1/6 region, there is an already existing restoration below which a secondary caries has progressed and involved the pulp. But in the pulp chamber, you can visualize a well-defined radio opaque mass, which is something unusual on a routine radiographic appearance. If you see the adjacent tooth, you see that the pulp chamber and the root canal are clear radiolucent masses, wherein here there is a well-defined radio opacity, and on opening the access canal, access cavity, you can see that there is an obstruction in the pulp chamber, which is more like a stone. So this is what we call it as a pulp stone, or otherwise also called as a denticle, because it has a close resemblance to the dentinal tubules. Structurally, it resembles the dentinal tubules. So pulp calcifications are nothing but they are calcifications which can occur within the pulp of a tooth, but it can occur in any portion of the pulp. It may be occurring in the pulp chamber or the root canal, but very commonly it is encountered in the pulp chambers. So in this radiograph, we can visualize the radiopaque masses which are there in the pulp chambers of both the molars. So how do we classify these pulp stones? So we classify these pulp stones based upon two entities. One is based upon their structure, that is histologically how they are going to, whether they are resembling the dentine tubules or not. We classify them as true denticles, false denticles, or diffuse calcifications. And based upon their location, we can classify them as free pulp stones, attached pulp stones, or embedded pulp stones. So we will be discussing all these entities in detail in the presentation. So as you see, this is a cross section of a tooth. I mean the longitudinal section of a tooth, which is showing enamel dentin. This is just a pictorial representation for a better understanding. And you can see the pulp chamber here and the root canal here. The red portion indicates the pulpal extent, and you can see in the pulp certain concentric structures are visible. This is what is called as a pulp stone. So when you get a calcification in a soft tissue, which is the pulp, we call it as a pulp stone or pulpal calcification. So when you see this pulp stone is not attached to the dentinal wall, neither it is embedded in the pulpal structure, but rather it is free. So we call such pulp stones as free pulp stones. When the pulp stones have an attachment to the dentinal wall, then we call it as an attached pulp stone. Sometimes they get embedded, and that is when they are called as embedded pulp stone. So based upon their location, we can call them either as a free pulp stone, attached pulp stone, or an embedded pulp stone. So this is another pencil diagram that is showing you the different types of pulp stones. So this is a free, this is an attached, and this is an embedded. And based upon, as I have already discussed, based upon their structure, we can call them as true pulp stones, where they have dentine-like arrangements of calcification. The calcification is resembling more like a dentinal tubule. Then we call it as a true pulp stone or a denticle, wherein false pulp stones are just concentric circles of calcifications. You don't get to see the dentinal tubule like arrangement. And there are also diffuse calcifications where you neither get dentinal tubule like appearance or the concentric lamellar pattern which is there in the false pulp stone. So talking about the idiopathogenesis, what is causing these pulp stones? So these pulp stones generally form around a nidus. Nidus means a source. So this source slowly starts depositing minerals around it. But this nidus can come either as a result of local metabolic dysfunction, which may lead to hyalinization of any injured cells, which may undergo fibrosis and serve as a nidus for pulpstone formation. Or when there is any trauma to the tooth, there could be a vascular damage which can cause thrombosis or vessel wall damage, which can lead as a nidus and lead to mineralization, ultimately leading to pulpstones. So, talking about the true denticles, they resemble the dentine because of their tubular structure. They have greater resemblance to the secondary dentine and they are common in pulp chamber than in the root canal. So, this is another pictorial representation. So, false denticles, they are usually masses of calcified material without dentinal tubules. These nodules present with concentric layers or lamellae deposited around a central nidus. They are larger in size and may even fill the entire of the pulp chamber. Diffuse calcifications are usually seen in root canal rather than the pulp chambers, and they resemble calcifications seen in degenerated tissue, like an amorphous calcification. They appear unorganized linear strands or columns paralleling the blood vessels and nerves of the pulp. So this is another picture where we get to see the true pulp stones, false pulp stones, and diffuse calcifications. So this may not be the source of the pain, but these are accidental findings, incidental findings when you get to treat a pulpal inflammation. Thank you.